So here is a sobering truth that I want to speak about today, and that's that climate change poses a serious, immediate, and global threat to human health. But we are here today as public health leaders, as policymakers, and as citizens of the planet to figure out what we are in fact going to do about climate change. That is a pressing question that stands before us.
Today's declaration by the U.S. Surgeon General marks a dramatic shift in our nation's focus and collective efforts to reduce the serious health impacts of climate change.
Not only have I spent decades treating patients with heart and lung disease, conditions made worse during periods of high heat and unhealthy air, but my youngest granddaughter suffers from asthma and has been hospitalized many times with asthma flare-ups, which are not only frightening for her to have, but they're compellingly hard as a grandparent to watch your grandchild suffer so. High heat, unhealthy air, changes in rain and snow patterns. This is the face of climate change, and this is where the danger to human health begins.
I am here representing U.S. Health and Human Services and Secretary Sylvia Burwell, and in fact the White House and the Surgeon General who made this landmark statement today about climate change. More warm days or rising seas, how does that matter to a person's public health? It matters directly and immensely. It directly impacts a person's respiratory health and particularly makes more acute those who have respiratory distress, whether it's COPD or asthma and a whole number of other very common ailments that are made considerably worse by the effects of climate change.
We know that climate change means higher temperatures overall. We know that higher temperatures mean worse air for cities, and more smog and more ozone. And we know that earlier springs and longer summers mean longer allergy seasons. Together, this means more clinic visits and hospital admissions for asthma, for allergies, and for respiratory disease. And this means more days of school missed, more days of work missed. It means more costly trips to the doctor.
We need to take action. We can't stand by any longer and think that next year we'll do something about it. We need to start this year.
Yesterday, EPA released a report on climate change and the benefits of global action. A report that looks at both the physical and the economic damages of climate change in the U.S. The health benefits are clear. Tens of thousands of lives, hundreds of billions of dollars are saved annually in the U.S. by the end of this century.
As public health professionals, we have a critical role to play in educating the public about what's at risk. Whether it's high heat, increased ozone days, longer pollen seasons, forest fires, more deer ticks, or the stress that comes with severe weather events.
We feel that public health professionals, healthcare professionals, medical professionals, that all of us together should be acting on climate change now. There's a lot of health effects that we see in Maine, sometimes even faster than other places in the country. Why it's most important for us in particular to be looking at climate change and its public health effects and not thinking about things that we should be doing 50 years from now, but things that we need to be doing now that can affect our health now.
Maine's location at the end of the nation's tailpipe puts us at a particular risk. Our asthma rate is one of the highest in the nation, and the cost of lung disease put a huge burden on our families, businesses, and the healthcare system. People in southern, coastal, and down east Maine get the worst of it. These are troubling signs and point to the need for federal action to reduce air pollution that crosses our borders. Cleaning up sources of carbon and other harmful pollution is the best action against climate change, and frankly, the lowest hanging fruit in our efforts to stem the dangerous tide of climate change.
And this is something as a physician I see every day. We deal with people with lung disease and emphysema and asthma and diagnose lung cancer on a daily basis, and we need to do something about this.
Each of us has a responsibility to do what we can, as much as we can, and for as long as we can. And certainly I would say that when scientists and doctors and public health practitioners are coming together with everyone from presidents to prime ministers to even the Pope himself, it is certainly time to take action, and I would say it's well past time, in fact.
Maine physicians stand together with the Surgeon General and our international colleagues in calling for action on climate change.
We know that we need to do something, that we need to take action. At last, there is a chorus of voices at the highest level speaking out on this issue, which is global, but also affects us right here in Maine.